Amy came to me yesterday with a question about how much does the DEA track every single time you change a prescription. And they don't necessarily do that, but I understood her underlying question. And I think it's a question that every provider has if they're willing to write controlled medicines. How do I stay off of their radar? Well, on one hand, I know that I can't. Probably because of TikTok. No, that's not what I mean. On one hand, I know that I can't stay off their radar. Okay? If you use the DEA's number that they force you to buy, you are on their radar. So what you have to be doing is providing good quality care and documenting it very well. There are some very specific times when a provider has to document the plan very well. And you're going to say, and it's going to sound like it's contradictory. The first time that it's very important that you document your plan of care very well is when it's not working. Okay? You need to be very specific about what aspects of it are not working. You need to be very specific about all the adjunct therapies that you're doing and all the different ways that you're trying to not prescribe more opioids or more benzos, even though that may be what they ultimately end up needing. So when the plan of care is not working, you really got to document that. And the other time that you really have to document the plan of care well is when it's working. And so what I mean by that is, if you go through all of that and you make a change, it's really important that you document the patient's response to that very same change. Okay? The patient was unable to do blank. He got these opioids, and now, bless God, he can do blank. And it usually needs to be more meaningful than they can sit on the sofa and watch TV in comfort. It's got to be a little bit more. You just need to understand. It doesn't mean that there aren't some people who are completely bedbound who still need pain management. Absolutely, they do. Okay? But that patient's care plan looks more like, they were, completely nonverbal in their pain and they're just basically, you present someone almost in a vegetative state. You give them the right medicines, and all of a sudden they're interacting with their loved ones, and they are giving and receiving communication and things like that. But either way, it's very important as a provider to document strongly when a care plan is not working, and then even more strong when the care plan is changed and it begins to work. Now, there are long periods of time in a patient's plan where we are just we found the right dose and they're just coming for their refills, and there's nothing wrong with that. But even for that patient, that's still called the plan is working. So every once in a while, you really have to go into detail about what makes this plan so awesome. And I thought that this insight to the worries of a provider would be really useful for y'all today, that y'all can really see, that there is so much that goes on between the yes and the no. I'm going to say that again. There is so very much that goes on between the yes and the no. I love y'all, no buts.